All right. So mahalo for joining us for Medicare and Medicaid 101. My name is Lisa Leilani Kaanoi, and I'm the engagement specialist for Maoli Ola Ma Lama Lama at Papa Ola Lokahi. I just want to go through some housekeeping rules if this is your first time joining us today. So this will be recorded and shared with those that registered. So for future webinars, if you'd like to attend one and you're unable to, as long as you register, you will receive the recording. And then also for any comments or questions or feedback, you can use either the Q&A feature or the chat feature, which is located on the Zoom toolbar on the bottom of your screen. And also, if this is your first time attending one of our webinars, you will automatically be added to our email list for future webinars. And then at the end, there will be a little link to that pops up for an evaluation. If you could fill that out, that would be great. That's where we get ideas for future topics. And this webinar is an hour and a half long, so if you're unable to fill it out and you have to run, that's okay too. We'll follow up with an email on Monday to get your mana'o. So mahalo. So I'm going to go ahead and introduce our guest speakers today. Let me stop share. There we go. So our first one that I have is Kaʻili Honbo, born and raised in Kailua, Oahu. She inspires to educate our Hawaii communities to live happier, healthier lives. With well over 17 years of extensive management experience in the healthcare and insurance industry, she is an ideal fit at Aloha Care. As a Medicare sales leader at Aloha Care, Kaʻili applies a client-centric approach to developing solutions that strengthen our healthcare presence in the Hawaii market and its long-term commitment to the communities that we serve. She is dedicated to guiding our Hawaii through the rapid changing world of healthcare and specializes in programs that serve our Medicaid and Medicare beneficiaries. In the process, she strives to create rewarding and enriching experiences through educational and community outreach. With the collaborative efforts of our Hawaii health plans, community partners, and employers, Kaʻili will strive to make a difference, demonstrating a high level of integrity that will earn the trust of those we serve. We also have Herman Hoy, who is a broker relationship manager with Humana, working with 300 plus agents throughout the island since 2019. Prior to his current role, he was part of the internal marketing and sales team, servicing over 1,000 Medicare members with their healthcare needs. He is married and he has two keiki, ages 8 and 13. He loves spending time with his family, as well as constantly learning new ways to improve himself. And also on the call, we have Andreas Cravalho, which he'll do a brief introduction of himself. I believe that he has another meeting that he has to attend to. And then also my brother-in-law, Kalei Kaanoi, which I'll have him introduce himself. So welcome, everyone. So Kalei is going first, correct? Okay.
Correct.
Okay. And then would you like me to advance your slides, or are you going to do it?
That's a great question. Yeah, you can advance for me because I kind of chew and walk at the same time. Yeah, I'm just kidding.
Okay, let's see here. Yours is the Medicare?
Yes, Medicare 101.
Okay.
So thank you folks for joining us. My name is Kalei Kaanoi. As Lisa had mentioned, she's my sister-in-law. She's married to my brother that's older than me by like 364 days. I'm born on October 5th and he's October 11th. So our birthdays are coming up and we're trying to plan some kind of a little staycation because of COVID. But but even a staycation with our family, that could be kind of too many people. So you guys never heard that. Disregard that. Okay, so I'm gonna do Medicare 101. It's the basics of Medicare, and I'll try to get through this. For me as an educator, I've done this so many times. It's almost like I'm sleepwalking, but I'm gonna just kind of go through the basics. I'm not sure on everyone who's on the call, but hopefully I can keep this entertaining. Normally, when people turn 65 or they're disabled, they qualify for Medicare. So somebody who's like 30 years old that has a disability for 24 months, they can qualify for Medicare also. So this Medicare educational program is for anybody who has Medicare A and B. If you guys have clients out there, or if you're in Medicare, I'm going to just go over the basics. Okay, Lisa, next slide. So this Medicare education, we're not going to go into specifics about programs. As you've seen on the front page and the corner of these pages, I work for a company and run a company here in Hawaii called Plan Advisors Hawaii. We're an extension of a national group that's all over the country. We have added the Hawaii term to show you guys that we can bring the education of the whole country here to Hawaii because we have agents all across the country. That's my self-promotion, my 2-minute script on Plan Advisors, then I'll focus on our subject matter, Medicare coverage. Okay, so I hope you guys enjoy this. We got great things ahead to cover. Go ahead. So when do you sign up for Medicare? As long as you got Medicare, you're turning 65, original Medicare is something you pay taxes for while you're working. You need to work 40 credit hours, which is equivalent to 10 years. Original Medicare is comprised of A and B, which A stands for hospital coverage and B stands for doctor coverages. Okay, next. So you would sign up 6 months prior to your enrollment. Okay, so your Medicare plan options, there's a few different options out there. You can have what is called original Medicare. That's Medicare Parts A and B, hospital coverage, and Part B is going to be your doctor coverage. And we're going to also go over Medicare Part D, which is drug coverage. Prescription drugs, and then things to consider when joining a Medicare plan. You have to live in the service area of that plan, and you want to make sure that if you're currently working, you're not you don't need to have group coverage when you're working after age 65 and Medicare. So you can get Medicare at age 65 automatically, which is your hospital coverage at no cost. Your Part B will have a charge to it, approximately $150. So and then the other thing too is if you're getting coverage through an employer, or if you're a part of a union, if you're a state worker, city and county worker, a union worker, or federal or a military retiree or a veteran, those are all things to consider when you're joining a Medicare plan. Next. So the initial enrollment period is the IEP is when you're 6 months prior to turning 3 months prior to turning age 65, the month of, and 3 months after. Your general enrollment period is starting in January. Special enrollment period is, there's different types of special enrollment periods. For example, if you're leaving your employer coverage, you qualify for a special enrollment period. If you have both Medicare and Medicaid, you have a special enrollment period called dual SNP. These are just a few examples. So keep in mind, when you're working with Medicare, there's a lot of different options. So one of the things as an advisor for Medicare is good. We don't charge any fees, and we're able to help people become their expert and their human resources in retirement. So that's key component is that if you're gonna retire or if you're turning 65, you have someone to depend on. And recently, because of COVID, we've seen a lot of commercials on TV. these are the Joe Namaths of the world, where they talk to you and they promise you everything in the world, and you call a call center. And when you talk to that call center person, they're going to try to put you in a plan immediately. And they're probably located in the mainland. One of the important things that we would like to stress is that it's important that you might want to work with a local broker that doesn't charge any fees, and they know the lay of the land. They know the doctors, the physician groups. They are going to be able to service you for the rest of your life. Whereas if you do some person do a presentation over the phone, a lot of times you can never get a hold of that person. So if you have a billing issue or servicing issue, it's always good to have a local agent that you can depend on and call, so that they can service you throughout your life. So we like to coin the term, we're looking for human resources retirement for life. Okay, next. Okay, so how do I sign up for Medicare? Collecting Social Security. Okay, when you're turning 65, you can call Social Security and activate your Part B. For those of you who are working and you're not collecting Social Security, they need to know if you want to have Part A and B activated, or if you want to activate Part B, because if you're working and you're not collecting Social Security, it's not going to happen automatically. If the only time it happens automatically is if you're starting to collect Social Security. So for those of you collecting Social Security, Part B will happen automatically. If you're not collecting Social Security, you have to call Social Security. Or if you're not collecting Social Security, you have to call and enroll in Medicare, and you have to pay quarterly for your Part B. And that's approximately $150. And your card is going to arrive in your mail 3 or 4 months before your 65th birthday. Okay, and yeah, so this is if you're not collecting Social Security 100 days before your birth month. And then these are the ways you can enroll. You can call Social Security at 800-772-1213, or you can sign up for your Medicare Part B on Medicare.gov. Medicare.gov is a very extensive website. They update it annually. And if you're having difficulties navigating through Medicare.gov, this is one of the reasons you want to work with a local broker. There's about 10 different agencies across the state. So we have a lot of agents that can service you. And keep in mind, once again, we do not charge a fee. This is something free of service. It's good to have a broker. The brokers get paid by the insurance companies they enroll you in. So one of the goals as a broker is to put you in a plan that's best for you, because the goal of the broker is to service you for life. If they put you in, if there's 15 plans out there and they put you in the worst ranked plan, you're going to have high costs, high co-insurance. You might want to make sure that you're working with a broker that's going to take care of you. Our goal is to help you save money, because when people retire, the two major concerns, number one is running out of money. Number two is healthcare. So if we're able to help you save money and help you with your healthcare, we can help you accomplish those two things in your retirement. Okay, next slide. And this is what the original Medicare card looks like. It'll have your name and your Medicare number. Prior to 3-4 years ago, you used to have your Social Security number and a letter after it. And then over here, but because of fraud, they put a special code. Your Medicare card is going to be filed with your physician and your specialist. But if you're going to join a different type of program, you're going to want to not have your Medicare card. You can keep it at home, but make sure you keep it in a safe place, because other people can still use your Medicare card with fraud. But we'll continue in the future slides about your options with Medicare. So the hospital Part A includes all your coverages for hospital, and that's your start date. If your birthday was in March, normally you start the month of your birth date, unless it's your birth date is on the 1st, you can start the previous month. Medicare Part B is all your coverages, so basically everything outside the hospital. Next.
Sorry, Kalei, you're cutting in and out. So
Okay,
I
you
don't
know what? I
know.
think I had my hand in front of the speaker. Can you hear me now?
It might be your connection.
Okay.
Okay, sometimes it works better if you turn off your video.
Okay, I'll do that. Okay, can you guys hear me now?
So far,
Test,
we'll
Test 1, 2,
see.
3. Okay, let's go
Yep.
and try it out now.
Okay,
Kalamai, kalamai.
next slide.
Yes. Okay, so this is what Part A covers for original Medicare. You don't have to pay any premiums. In your first 60 days, you're covered at 100%. After your first 20 days of skilled nursing, you're covered at 100%. And then you have to pay a $1,400 and $8. 14 and 8. Now, I apologize. This is for 2019. And I'm just realizing that it's not updated. So the number is going to be skewed a little. Herman, you got that number?
I can look it up. You want
Yeah.
2022 or 2021?
2022 would be good for everyone on this. So everyone who joins, there's an open enrollment period which starts October 15th through December 7th. And when you join in October 15th through December 7th, for a new plan that is going to determine what your cost is. So every year, this through inflation, this deductible is going to change. So your advisor can explain that to you. Yeah. Okay, next slide. Part B, medical services, 144. It's approximately $150 now through inflation. This is going to cover your medical services outside of the hospital, which is like your doctors, your lab work, x-rays, ambulance, emergency room, and outpatient surgery. Some people might not know what outpatient surgery, that's any surgery that's done outside of the hospital. And the most common outpatient surgeries we see with retirees is cataract surgery. So you go in that day, you come out the same day. And the other one is like colonoscopy. Okay, and it's an 80-20 plan, which is where Medicare pays the 80% and you pay the 20%. Okay, and then you get a $198 deductible. Next slide. So just to explain that $198 deductible. So for Part B, if you went to a doctor and you went and the doctor charges $100, you would have to pay that full $100. And the next time you go doctor and it costs $100, you'd have to pay $98 to accomplish that $198 deductible. But one of the options is if you purchase a supplement or if you get into a Medicare Advantage plan, they get rid of that deductible. And that's something you want to discuss with your agent also. Okay, what you don't get with A and B, A and B does not cover dental. That's the number one question we get when we talk to members is after explaining our Medicare programs, is they always ask, do you guys have dental coverage? Okay, the next question is, do you guys offer vision coverage, glasses or contact lenses, or how much does it cost to see an eye doctor? Prescription drugs is not covered by Medicare, okay? And then hearing aids is not covered. And then the last one is long-term care. A lot of times people think Medicare is going to cover you for long-term care, but that's a whole total different package. In Hawaii, we have a lot of care homes where when people can't do certain activities of daily living, like going to the restroom or cooking food, when you fall under a situation where you can't do that stuff, you have to lean on one of two things, which is either long-term care, or you got to try to see if you can qualify for Medicaid, and that depends on income. Okay, so 1484, just in the messaging, 1484 is the deductible for hospital Part A. Okay, Lisa, next slide. Okay, so when do you delay Part B? If you're currently working, for a lot of people in Hawaii, cost of living is high, and at the same time, we're very a lot of people are active in Hawaii, and they want to continue working up till age 70. So if that was to occur, in some situations, it wouldn't make sense to activate your Medicare Part B because you have to pay that $150. Because what ends up happening is you're going to activate the Part B, you're going to get 80% coverage for Medicare, but your plan that you're working with probably already covers 80 or 90%. The only reason you would add Medicare is if you had like a circumstance where you're going to want to have everything covered, deductibles covered, and 100% coverage because you're a high utilizer. That might make sense to have double coverage, okay? So when you're covered under your spouse's employer health plan, there is no penalties and there's no loss of options. So whether you are working or your spouse is working, they have coverage through the employer group, you don't have to add coverage. Okay, next.
Kalei, I just want to say this is the only time you're going to boss me around, okay?
What's that?
Like, this is the only time you're going to boss me around.
Okay, I got that. Thank you, Lisa. Just flip the slide, please. Now I'm just playing. Okay. Now where do we go? Okay, so this is when you join Medicare, there's different avenues you can go. One of them is you stay with your employer group health plan. Some people have legacy benefits. If you're working for the state pays for your Medicare Part B coverage, and they also have a supplemental plan for you. Depending on how many years you work with the state, they'll cover that. Whatever Medicare doesn't cover, they'll cover. There is an option called a Medicare supplement. This will cover the 20% that Medicare doesn't cover. In certain circumstances, if there's a few different mentalities of how customers think. Some people are conservative and they just say, I don't want to worry about co-pays or co-insurance. Give me the supplement, I'll pay for it. And they don't have to worry about any co-pays or co-insurance. For some people, they might be high utilizers where they might have, and knock on wood, we don't get this, but somebody might have cancer and, cancer with chemotherapy, Part B would cover it. Chemotherapy can be in excess of $25,000 and with insurance of 20%, that's $5,000 out of pocket. But if you're doing that 2 or 3 times in a year, that could be a hefty bill to pay. So it might make sense to pay like the $120 or $150 for a Medicare Part B, knowing that you have foreseen events happening in the future. So those are the 2 types of people that will get a supplement. Is money is not an issue, and they're willing to pay for that 20% gap coverage. Or if they are high utilizer and they are anticipating high costs for the future, then they'll get a supplement. The third option is a Medicare Advantage plan. And basically a Medicare Advantage plan is when a private company runs the plan for you. They take over the original Medicare. Medicare, the federal government pays that private company per month per member to cover your original Medicare and additional coverages. In a lot of situations, a Medicare Advantage company has additional benefits like dental and vision and hearing aid coverage and all that good stuff. So that's what we do as advisors, is we try to check out how the member is, and we can guide them towards these different pathways. Okay, next. Okay. So when you're in if you're a retiree in a group plan that covers you or a union plan, there's a few questions you want to ask yourself is, are these copays, are there copays and deductibles? Does it include a prescription drug plan? And then if you opt to not take it, will you be able to come back later? Just as an example, if you're a federal retiree, they let you freeze your account and you can save money because a federal program costs $150 a month. So if you wanted to save that $150, you can freeze the account and then go with an Advantage plan. And at a later date, if you have more utilization, you want to get the benefit of a federal plan, and you can activate it in a future date. So what is the cost? How much does it cost for your group plan? In that situation I just explained, if you're a federal retiree, you got to pay $150 for the HMO and $250 for the PPO, which give you national coverage. So that's an example with the federals. And does it include dental and vision coverage? If you're going to pay a premium for your group coverage in retirement, most of these plans should have a dental and vision, but if it doesn't and it costs a lot, we can help you with that benefit and look that up. Okay, next. Okay, Medicare supplement. It's federally standardized. All the companies that have it, it's like a financial product. It's not a product that is underwritten. It is underwritten. I apologize. It is underwritten, but it's standardized. Whether you go with Plan A, Plan B, Plan C, all the plans are going to be the same. In this situation, the reason you'd want to work with a broker is because they can find the plan that is least cost to you. So one company can charge $200 a month and another company can charge $100 a month, and it's the exact same plan. So you would want to make sure that a broker can look out for those costs for you. There's 10 different plans A through N. Most brokers work with 3 major plans. They're called F if you turn 65 before 2020. There's a plan G, a plan N, and those are the 3 major plans most brokers work with. Okay, and all policies offer the same basic benefits. Next, please. Thank you. Okay, when is it the best path? Okay, you want to budget your medical costs, and if you travel a lot, that could be the difference between choosing an HMO or PPO, but most cover travel benefits for emergency and urgent care. And then you want to make sure one of the highest ranking things that people are concerned with is their doctor in the network. Do they have to get referrals? Doctors in network is very important. So as a broker, will make sure that they check that for you. Some plans have no co-pays or no deductibles, and make sure you're sure to get it. When you get it, can you keep it? So most plans are year to year. They start January and they continue to December 31st. And if you decide to stay with it, you don't have to do anything. It'll just automatically renew itself. Next. Okay, Medicare Advantage, also known as Part C, takes the place of A and B. I explained this, and they also include Part D. Their different plans are called PPO, which stands for Preferred Provider Organization. This is where you can see specialists without a referral. And the HMO is as an example here locally, we have Kaiser. It has an HMO. Aloha Care is an HMO. Humana is an HMO. HMOs are where you go to see your primary care doctor, and they're a maintenance organization where they try to have your primary doctor be your coach and direct you to your different specialists. And usually there's one or more plans available in your county, and these plans are county specific. So if you're living on Oahu, you move to the Big Island, you would have to get a new plan on the Big Island, because Big Island is in a different county. Okay. And then Medicare Advantage plans, they include a maximum out of pocket. This protects you so that you don't have to sell your house and mortgage it to pay $50,000. Most of these maximum out of pockets, they range around $6,000 to $7,000, where you don't break the bank. Okay, next. Okay, when is the best path? Okay, so the goal is we try to keep your premiums low. Okay, and then if you have veteran services, we can help you with that. And then the network of doctors is important. And if somebody is on low income subsidy, we have a chart on a yearly basis. Those low income subsidy, the amount changes, but we are able to identify if you can get into special programs through low income subsidy. Okay, next. And prescription drugs, most Medicare Advantage comes with prescription drugs, but if you decide not to join a Medicare Advantage and you just want the drug plan, This is called a Part D, and each of these plans vary by county. So an example of wanting a Part D drug plan is if you have original Medicare and you join a supplement. Supplements do not come with a Part D, so you would have to add this on. So if you join a supplement and it costs $100, the average cost of a Part D drug plan would be about $20 to $30. You would pay that in addition to your Medicare supplement. And in some situations, it is included with in your retirement plan. And if you don't join right away, you can get a penalty for Part D drug plans. And veterans are exempt from that penalty because they have a credible coverage through veteran services. Next. Okay, so the extra help with your prescription drug, that's the low income subsidy we talked about. There's a large population out there where they don't qualify for or they can qualify for low income subsidy, and this is where if this price changes from year to year. It's as of right now, if your annual income is less than 22,000 for a single and 29,700 for a couple, you qualify. And this enables you to enroll in and get a special enrollment period, so you can join a Medicare Advantage plan and keep your costs down low. If you have resources of or savings of less than 14,600 or 29,000 for couples, this also helps. That's another qualification that you're going to need. And it helps with the deductibles, co-pays, co-insurance. So this will also eliminate you from getting that penalty if somebody qualified for low income subsidy. Okay, next. And then 2020, the coverage gap, that's when you spend $4,020, and after $4,020 from 20, so keep in mind these change a little bit, so it might be like a little less than that, or a little more, I'm sorry. But when you set an appointment, we'll have the updated numbers, but this is approximate from 2020. When you and the insurance company spend that 4,000, then from 4,000 to 6,000, you got to pay 25% for generics and 25% for brand name and 95% out of pocket. Catastrophic coverage is after 6,350. Next. Okay, so I think that was a lot. So how do you choose? We're getting wrapped up. Sorry, this is taking a while. Okay, so here's what we can do for your clients. Okay, we can get a list of your doctors and your preferred hospital. And what we do is we get a current list of your medications. Normally, we cannot ask for medications. The way we do it is we ask a member if we want to look up the cost of the medication. Okay, and then that in a lot of situations, we can help determine the costs and which plans might be best for the client. Okay, and then if there's any upcoming events that might happen, that's important because certain plans have a percentage for outpatient. Some plans have a set copay. So the set copay might favor the member if they're going to have a procedure coming up in the future. So we would take that into consideration. And then what do they like about the plan they currently have? That will also help us determine what the member likes in that plan, and then that'll help us guide you to pick a plan. Okay, and then we take all this data and we show the member the presentation, and then we review the program with them. And we can do these meetings in person. With COVID happening, we can do meetings via Zoom. A lot of seniors, or not a lot, but some seniors might not have access to a computer. We always try to find out if they have a daughter or a relative or a neighbor that they can use their computer. And then that way we can still be safe with COVID. But if they can't, we can come with a mask or do a presentation over the phone, drop a booklet off, and be outside in the car. We can go through the booklet together. So there are strategies and during this COVID time to help the members, and then we'll put them in the most suitable plan. Okay, next. Okay, So it's okay to get help from the right Medicare advisor. Checking out what the cost is, helping you understand cost, going over your benefits. We keep you informed on your benefits and keep what makes you keep them, and convenience. Okay, we help with partnering with doctors and different partners in the community that work with the seniors and getting authorizations and referrals. And we do a thorough needs analysis to help you better understand. And then we make sure that, you know, we're going to check on your doctors and see they're in the network. Okay, all of this at no cost to you. And I guess with that being said, yes, so are there any plans that cover hearing aids? So that would depend. There's different qualifications, right? So if you qualify for Medicare and Medicaid, which is if you have low income, yes, we do have hearing aid coverage. And then, yes, we do have companies with Medicare Advantage plans that do have hearing aid coverages, but I can't go over the cost or any benefits from each individual plan. But yeah, definitely we can find a program that has hearing aid coverage, okay? Okay, so
Mahalo,
that's,
Kalei.
thank
Is there
you.
any other questions from folks? That was a lot of information.
A lot of information. If you guys want, you guys can put it in the chat. I can answer it back while we have the next presenter go on.
And then also I'll have their contact information, and everyone will get the slides and the recording. So mahalo, Kalei. And then next is Kaʻili, right?
Kaʻili's gonna go last. We'll go with Herman next.
Okay, should I go ahead and have Andreas just quickly introduce himself?
Sure. Andreas?
Or did he go to his meeting?
There he is. He's
Okay.
I'm here. Hi, so my name is Andreas Cravalho. I'm the Senior Director at Aloha Care. Can you hear me?
There's a little bit of
I'm the
echo, but
senior-
yeah, we can hear you.
Hear you.
I don't know which one. So I'm the Senior Director of Product Management at Aloha Care. I've been with Aloha Care for the last 2 years. I've been doing Medicaid for 27 years. And thank you so much for having us here today.
Mahalo. Okay, we will try to, somebody needs to be muted. Okay, there we go. Okay, Kaʻili, you're up.
I think that I was going to go last. I think
Oh, sorry, Herman. Sorry.
that's okay, Herman.
Okay, Herman, do you want me to advance your slides, or are you good?
Yes, please, Lisa, if you could help me with that, that'll be great.
Okay.
All right, and I'm gonna keep my screen or camera off because hoping that this will make it a little bit smoother for everybody. Just to do a quick test, is the sound coming through okay? Are there any echoes?
You're good.
Okay, great. All right, so thank you so much for allowing us to, participate in this event. I want to just introduce myself again. My name is Herman Hoy. I am from Humana, representing Humana. I'm the broker relationship manager here for the state. And I work with, like Lisa said, an introduction, a few hundred brokers to help them assist and to navigate through the Medicare system on behalf of our kupunas. So today I have a special presentation to show you or share with you in regards to basically what Humana is, but not really on the insurance aspect of it, but more in the what we call human care aspect of what we do. So, and this is very innovative, and I'm very proud to say these, talk about this, because we're more than just an insurance company, and I think that our culture is definitely going to be shown in my presentation here. So we're going to go with the first slide, second slide, yes, please. So human care, I mentioned earlier, it's not just a catchphrase. It is simply like kind of like our model that we work off of on a day-to-day basis to help our members lead healthier, happier lives. And, you know, this is how basically we bring the essence of the human care. You know, we help members find the right doctors. We help them with transportation to the doctors. We would be helping members find cost-sharing solutions on prescriptions, as well as teaching them how to use telehealth, especially during COVID. And so these are some of the things that I believe are, you know, a lot of our competitors in the community should be on board as well, because we have to be more than just paying for doctors, hospitals, and medications. Next slide, please. All right, so like I mentioned earlier, the components that makes us more than just an insurance company is the following here. As you can see, all these are a partner and resources for our members. First of all, the primary care doctor. We have home health care. We have Humana pharmacy. We have our bold goal, which is the constant reminder for us to exceed the expectation for our members, which is, you know, to be cognizant of human care rather than just insurance. We also have a Humana Foundation that offers many generous donations across the country. And we're looking forward to setting more partnerships up locally. We also have our veteran focus. We want to say thanks to all the service, you know, seniors or members that have, you know, sacrificed their, you know, themselves basically for our freedom. So in Humana, we do not want to forget about that. We have programs, especially to help veterans to be covered, giving them additional focus, additional benefits, and so forth. Last but not least, we have our broker partners, which is what Kalei had discussed earlier in his presentation. His role as a broker partner is also part of our human care. We don't want our members to have to navigate on their own. And we simply don't want them to have to deal with maybe an answer machine or a robocall, or just basically figuring it out on the internet. So we contract, employ, and work with agents out there, such as Kalei, and to service our community and make sure that we are not at a disconnect. Next slide, please. So some of the things that I wanted to highlight about our numbers is that, you know, it is our commitment to what we do. So we're very proud of these numbers. I'm looking forward to our numbers that we can provide in the future in regards to what we're doing in Hawaii. But so far we have these numbers in front of you that represents our kind of like our scorecard across the country. So as you can see here, we have we committed $50 million towards you know, coronavirus relief efforts. And then we did 2.6 million screenings for social determinants of health in 2019. And social determinants of health, we believe, is very important under our human care goal, because there are more than just insurance or healthcare needs that makes up the overall well-being of our members. And we're going to talk a little bit about that afterwards. And next we have our $450,000 donated to Feeding America for COVID-19 Response Fund, as well as committing 160,000 volunteer hours for committed by the Humana employees in 2020. Last but not least, we have made 2,000 outreach calls per day to Humana members, you know, on a yearly basis. So we're very proud of these stats, and we look forward to generating similar results in the state locally. Next slide, please. All right, so Humana makes living healthier easier, incorporating a lot of innovative and integrated benefits. So I'm not going to get into the details, but I'm just going to highlight some of the things that you know, most insurance companies don't have or don't talk about. Mainly, they focus more on, you know, just paying the copays and things like that, which we value a lot, and we're very competitive as far as those things are concerned. We know that is very important for people. However, the wellness aspect is also very important for us and for our members as well. So we offer things like healthy food cards. And keep in mind, some of these benefits are not available for all plans, but I'm just highlighting to you the logic of where Humana is going in terms of human care is concerned. And so we also have a Silver Sneakers program, which offers gym membership and online workout activities for members to utilize at the comfort of their own home, or they can choose one of our contracted gyms locations across the country free of charge. We also have our Go 365, which is a reward-based program to incentivize members to stay healthy and to reward them with gift cards that they can use to spend to buy gifts on a yearly basis. And I'll get into that a little bit later as well. Of course, we offer dental and vision, which is definitely a need for all of our population, especially our seniors and kapunas, as well as prescription drug coverages. Next slide, please. And then we also have what we call the OTC program, which is over-the-counter items, things like Tylenol, a toothbrush, toothpaste. Each member receives credit so that they can go and redeem those and purchase those from our Humana pharmacy, so that they don't have to waste money buying them at the store, at the Costco, things like vitamin, CoQ10s, dental floss, maybe even walkers. Those are the things that a lot of times is missed, because that's very important to a member's overall well-being. You know, just as simple as maybe an anti-slip mat in the bathroom. And I mentioned a little bit about the mail order pharmacy. This makes it easier for our members to obtain medications without having to wait in the long line at our local retail pharmacies, which they're great. You know, they're convenient, and they are also participating and covered under the plan. However, Humana also have our own pharmacy mail order, where many of the generics are covered at zero copay, and it's mailed to you, and it's kept on record. So Humana would keep it on track, on file, to send you reminders, as well as send your doctors reminders. So making it easier for you to focus on what you like to do the most, which is enjoying your life, spending time with your family, and leaving the keeping track of medication and things like that to us. Because keeping track of medication, taking the right one, and having the right medication match is extremely important. Next, we have telehealth. You all know, because of you know, social distancing, many you know, I would say vendors or things that we do on a daily basis had become remote. And also visiting the doctors, getting answers to your healthcare question, also when remote. So we have capabilities at no cost to our members, telehealth functions that they can obtain and get access to care 24 hours a day, 7 days a week. Last but not least, we know that especially in Hawaii, with traffic, cost of the car, insurance, parking, even, it's a big hurdle in for our senior community, for them to access quality care, you know, in the state. So what we do is we added transportation benefit to some of our plans, where we pick you up, take you home, and all you have to do is pre-arranged meetings. We confirm with the doctors, and there's no cost. Everything is included and paid for by the plan. Next slide, please. So a little bit more stats that's relevant to basically some of the things that make us affordable and competitive. So we have many different monetary savings program. We have a Part B gift back program that we can help members navigate through, which through the use of an agent or broker such as Kalei, he can tap into the Humana resources to get access some savings. We have 60% of our 73 new plans that we offer across the country have a zero premium. Now, zero premium doesn't mean that the plan is junk or very bare minimum coverage. It just means that the money that we obtain through Medicare is enough to sustain the plan because we add all those preventive benefits that way, and we encourage early detection. So most of our clients, it's going to be able to maintain their health or improve their health, and that is part of our Bold Goal initiative. 60% of our plans has maintained the RX deductible amount, and 82% of the plans have lower or unchanged premium. This is very significant because in a long-term, I would say strategic goals, and also for the convenience of the member having a stable rate, this is definitely a number that we're very proud of. Next slide, please. And just wanted to say that we also added 125 plans and added 2 million eligible members across the counties, as well as 98 new PPO programs with a potential 1.6 million eligible members in the counties across the country. So these are some of the things that, to show that we have a big footprint across the country, and we're very fortunate to be able to join the Hawaii market since 2006. Next slide, please. A little bit more, I would say, accolades that we have. These are things that I think I'm very proud of, and at the same time, I'm humbly, sharing this to you in the public. And also, I want to really credit the people that are actively working to get this numbers done on a daily basis, as well as our providers, our doctors, our hospitals, and our members working together. And doing so, we've been voted by Newsweek and also other organizations to have #1 in customer service among health insurance companies. And these, you can look it up, on the internet. And we are #2 top Medicare insurer in the nation. We have almost 10 million members now across the country in all 50 states. We have roughly 21,000 members in Hawaii. And we're definitely excited to welcome, all of the seniors in Hawaii to take a look at us and, give us a try in the near future. 92% of our Humana members are in a 4-star and above quality plan. So 4 stars are, the star ratings are very important. It is a grade that Medicare grades the quality of the health plans. And as you can see here, 92% of our plan are 4 stars and above, and 5-star is the highest score. And we are able to have 27% fewer hospital admissions compared to the original Medicare. So what this means is that original Medicare is basically our boss. They have a job, which is to take care of seniors. And what we are showing is that our efficiency of taking care of the senior is 27 times fewer hospital admissions compared to original Medicare. And we also have a $3.5 billion medical expense savings compared to original Medicare. Next slide, please. I mentioned a little bit earlier on some of the things that we do to help, members continue to, utilize and meet with their doctors on a yearly basis, to basically set up annual wellness exams, to at least talk to your doctor once a year and go over the things that you normally don't get to do during a regular visit. As you know, the doctor's offices are very busy and you are very busy. So what we do is that we want to make sure that we encourage members to take the time, and we also compensate the doctors more on a yearly basis so that they can spend more time, maybe even 30 minutes, 45 minutes with you to go over the concerns that really matter. Basically, it's a win-win situation. And every year, our members here love this program. As you can see, there's a lot of gift cards. Some of them are not available for Hawaii, but many of these ones are, and we're continuously adding new vendors onto our list. And the way that you obtain these gift cards is basically just by doing things you already do, which is maybe exercising, going to community events, attending webinars such as this. If you're a Humana member already, this would consider a rewardable event. You would be able to put that down in either on your computer log or by phone, which I mentioned over here. It's shown on the slide here, and you will get a reward towards the gift card. So I know that not everybody is motivated by rewards, but we just feel that it's just an extra, that little encouragement to schedule an appointment to basically focus on an annual wellness exam, mammogram, colorectal screenings, flu shots, things like that. Next slide. Another benefit that we highlight that is often overlooked is our hearing coverages. We partner up with a vendor across the country known as True Hearing, and we're able to offer state-of-the-art hearing aids starting from $2,500 all the way to $3,500 retail costs. And for our members, you can get them as low as $150, and depending on which plan you on, up to $900. So as you can see, even at the most expensive copay of $900, you're still at a much better advantage as far as cost goes, because other programs, if you go to Costco or if you go to buy these hearing aids out in the public, they're going to cost you about $5,000 to $7,000 for a pair. And imagine being a Humana member, having all these other benefits and still be able to get hearing aids at that price. That is amazing. And these are all the choices that you can get and choose from, that's listed here. So all these styles are at the same price. It just depends on the channel levels. Some people like in the ear, some people like over the ear, and so forth. So we believe that hearing is a very important thing because it offers, it prevents members who has hearing loss, maybe suffer from isolation, loneliness, and also maybe it causes some physical imbalance as well if your hearing is affected. And so we spend a lot of focus and partnership with companies such as True Hearing to offer you these sort of benefits at this price. Scroll down, please. Next slide. Oh, one more up. One more. Sorry, guys. Skip a couple. There you go. So next we have also added the insulin savings program. What we find in the community is that a lot of people who are insulin dependent, because of the cost of the insulin, have to come up with a decision on a monthly basis whether to take medications or buy food. So, because of that, that decision is definitely not a good one to be thinking about, because without the insulin, you might not be able to control what the doctors need you to control. And also the doctors have a harder time assisting the patient because the person can't afford the cost of the insulin on a monthly basis. So the idea of the insulin savings program, which is designed by CMS, which is Medicare, it allows Humana to participate and offer the insulins at a fixed dollar amount. So you can see on the left-hand side what kind of costs a member typically has to go through, a senior has to pay up to, in a deductible stage in the beginning, up to $435 in the initial purchase of the insulin. So as you can see, $435 is a lot of money, and people are debating between whether to buy insulin, which is what the doctor advised, or put some food on the table. So in order to, our goal is to minimize that decision so that we participate in this insulin savings program. And you can see on the right-hand side, all the deductible, the co-pays after the deductible, as well as the coverage gap will all have a $35 copay on a monthly basis for the insulins that are covered under our list. And we have about 20 to 30 of them that's covered, which are the the common brands that everybody takes. So very, very crucial that our members understand this and they take a look at this on a yearly basis to utilize these benefits that are being offered on a yearly basis through an agent such as Kalei. Scroll down, please. So I'm just going to wrap up these the rest of these slides because these are talking about how Humana address human care by tackling the unhealthy days by identifying the root cause. So some of the root causes that Humana identify that adds to unhealthy days in a member's life or senior's lives is, of course, food insecurity. We have to also address loneliness and social isolations, as well as improving access to transportation. Next slide, please. As you can see here, this is just some of the graphs or stats that we want to highlight, that 1 in 9 Americans are suffering or being affected through the lack of food in our community. So, and we can see here, 50% of them are more likely to be diabetic. 60% of them are more likely to have congestive heart failure. 30% of them report to have at least have a limit on one activity of daily living. So very, very, I would say, alarming stats here. Some things that, my kids, myself, and many people in the community take for granted, but there are a huge population, especially seniors and our veterans, that are food insecure, even in our state of Hawaii. Next, please. Okay, so next we want to address, show an example of how we address loneliness by offering Humana members these type of tools, which is called, first of all, the friendship line, where you can basically pick up a phone and you can find a licensed clinical specialist to talk with you about things that you want to talk about that makes you feel lonely, depressed, or isolated, especially during COVID or the pandemic. You can, if you want someone to talk to about resources, about different plan options, definitely it's a no cost. It goes all the way to midnight Eastern time. So it's at least closes at 6 o'clock our time. And it's no cost to you, and there's no limit on how many times you can use it. And also we have in something called Speak with an Interested Listener. So it's part of the Friendship Line program where you can talk basically just to talk. And we find that it has been statistically shown very helpful. Anyone that is contemplating, especially, our suicide hotline, things like that. We don't take those things lightly. We take, psychological and mental illnesses very seriously. So those are the things that we have put in place so far to help curb that portion of the human care aspect. Next slide, please. And last but not least, of course, we have transportation. Like I mentioned earlier, many people actually in Hawaii and across the country have limited access to reliable transportation. A lot of times they feel that it's unsafe or it takes too long or it's too expensive, which is why some of our plans here offer transportation at no cost. There's no tip needed as well, take you to and from the doctor. It increases the doctor visit rate, and it improves overall health of the member and increases the safety of the ride or the traveling and the journey. Next, please. So basically what we at Humana try to accomplish or ask ourselves on a daily basis is we want every employee, member, and a community we serve to have more healthy days. So what we do is we have 4 question surveys that we ask. You don't have to answer them, but just as a takeaway from my presentation, you can ask yourself how you can help someone in the community and doing some of these things, or also remind yourself on how to obtain and move towards a healthier goal or healthier days. So the first question would be, would you say that in general your health is excellent, very good, good, fair, or poor? Number 2, thinking about your physical health, which includes physical illness and injury. How many days during the past 30 days was your physical health not well, not good? Thinking about your number 3, thinking about your mental health, which includes stress, depression, and problems with emotions. How many days during the past 30 days was your mental health not good? And last but not least, during the past 30 days, about how many days did poor physical or mental health keep you from doing your usual activities, such as self-care, work, or recreation? Next slide, please. And our final statement, and I'll wrap up, is social determinants of health can encompass environmental, financial, and societal concerns. Humana is in a unique position to support key social needs like food, social support, and transportation through health plan benefits and services that address the specific and acute needs of individual members. So I want to thank everybody for your time today. I know you could have been doing a lot of other fun things, especially on a Friday, but you are here with us. And I want to say thank you for your partnership. I want to thank the host of this event by putting this together. Very, very awesome event. And I believe my next slide is a thank you. Oh, before my thank you, I just wanted to introduce our local team here. We have great support staff for any questions, and usually, Kalei is in contact with our staff to offer the most up-to-date, accurate information, such as what we presented earlier to our senior community. Next, please. And last but not least, mahalo. Thank you for all you do in the community, folks. Back to you, Lisa.
There's some echo. I think somebody might have 2 devices on this webinar, and that's what's creating the echo. So if you have 2 devices on, you can turn the sound off of your second device. No, okay. So we did have a question, Herman. Mahalo. I'm going to stop share. Do patient with Humana powered by MDX Hawaii have access to the transportation resource?
The answer is yes, but as I mentioned, it's available for certain plan members. So we can check for you if that's something that they need to do, or during the open enrollment, it would be something that you can discuss with your agent as well. If plan changing is needed to adjust for transportation.
Okay, great. And just so our attendees or registrants know that we will include the questions in the chat and in the question and answer feature with the follow-up email after this with the recording. All right. So Kaʻili's up.
Okay, so did you want me to share my screen, or were you going to just bring my presentation up?
Oh no, you can share your screen.
Okay.
But it sounds like you're getting feedback. We're getting feedback from you.
Yeah, let me go ahead and see what that's all about.
Do you have a second laptop or a phone that's also logged in?
Bluetooths are off. Let me double check that real quick. While we're doing that, can we just go ahead and take a 5-minute break then? So I can go ahead and solve that problem, Lisa?
Sure, of course.
Okay, thank you so much.
So great time to get a drink of water or go take a bio break. A lot of information. And then Kaʻili will get her slides up, and we'll have all this in a follow-up email. So a lot of information. Does anybody else have any other questions they want to ask specific to your needs or to someone else's needs that you know might need these services or programs?
Lisa, I want to say something real quick.
Go ahead.
So when you had reached out to me to try to put together a panel, I tried to pick a combination of like a large national company and give an example of what they can offer to Hawaii. And what ends up happening, every company that is in Hawaii, like a lot of people know the term HMSA, they know that the company Kaiser. These companies have been around for like 40, 50, 60 years. What happens is when companies come here to Hawaii, I think the years are 10 years. Once you're 10 years, then you can be called kama'aina. So a lot of people think like the HMSAs of the world and the Kaisers are local companies. But the companies that we represent, United Healthcare, came in 2005. So I think we can call them local. And Humana is another company. They came in 2006. We can call them local. But the next speaker, Kaʻili, she comes from Aloha Care. Aloha Care is truly local. They started in Hawaii, and I believe their board members came from all the different FQHCs, and they were the first ones to partner with the state of Hawaii in terms of Medicaid. Yeah, so I wanted to get a mixture of a Medicare program, which is what Herman talked about, Medicare Advantage, and Kaʻili is going to talk about Medicaid. And they also have a Medicare Advantage program. So what Medicaid is, if any of you on the panel are not familiar or on the program, Medicaid is for lower income and it's provided by the state. So currently the state has done contracting with these different companies. Aloha Care has over 60,000 members that have Medicaid, and some Medicaid members are under 65, some are over 65. So the programs for Medicare Advantage, some companies do both Medicare and Medicaid, and they end up having no copays for all their benefits. The only thing they might have copays for is for the medications. So I wanted to give a mixture of both a private company that runs Medicare and a state-run private company that runs Medicaid. So Aloha Care is the largest Medicaid, or I'm sorry, don't misquote me on that, but Aloha Care was one of the first ones to run Medicaid in the state. And I wanted to have a expert person on the panel. Kaʻili's been 20 years in the healthcare industry, and she's a good resource too. And she runs the sales department for Aloha Care, and she's doing a heck of a job. So I just kind of want to fill in the gaps and let you know what we were trying to accomplish here today. The goal is all about education and finding out what is the best for our community of Native Hawaiian kupuna. Yeah.
Mahalo, Kalei. I think she's ready now.
Okay, Lisa, it says that the host disabled the participant screen sharing. So I think you just have to allow me to share.
No, just click on the square with the arrow on it. As a panelist, you should be able to share, but here, let me try it.
Yeah, Lisa, on your side, Lisa, there might be an arrow next to your square, and you have to allow.
No, I'm giving her co-host right now.
Yeah. Okay.
Okay, thank you. Oh, you cannot modify the advanced settings are locked.
Yeah, don't click on the little triangle going up, just click on the green box.
Can you guys see my screen?
Yeah, we just need, yep.
Okay, so thank you, Lisa, for coordinating this, and Kalei. Herman, it was great to collaborate with you too. It's been a long time, but thank you for the opportunity. Kalei, thanks for the great introduction. And I just wanted to say, like when Andreas did his intro, it's so great to have him as one of our senior leaders. He's our Senior Director of Product, where he oversees both Medicare and Medicaid products. And he comes with a wealth of experience in the Medicaid course integration industry. I think just under 30 years. And so combined with my Medicare experience and his Medicaid Quest integration experience is pretty exciting. So I'm going to go ahead and start. But, you know, as Kalei mentioned, you know, this is a great opportunity to provide, you know, educational resources for our community partners. And so honored to be here today. So what we're going to do today in my presentation is I wanted to just basically cover a little bit about Aloha Care, who we are, what we do, you know, and review our provider network partnership, and then talk about Medicare dual special needs plan, and then a little bit about our Medicaid overview. In addition to that, we're just going to discuss, you know, how do we become eligible for Medicaid? How do we become eligible for our plan? And then discuss, you know, what our plan entails, and then some resources that will be available to the public. So a little bit about us. So Aloha Care is a local nonprofit health organization. So we're deeply rooted in Hawaii's communities and experience for those that have both Medicare Quest integration, Medicaid Quest integration program, and also those that qualify for Medicare Advantage dual special needs plans. We're mission driven to support individual wellness and to promote community access to quality care in collaboration with our community health centers and others who share our commitment, like our community partners, like Popo Aloha Kahi, you know, and other nonprofit organizations within our communities. So as I mentioned, we're a local nonprofit community health plan. I think Kalei kind of mentioned our membership earlier, but we have just under 80,000 members across the state of Hawaii. And we were founded in 1994 by Hawaii's community health centers, also known as federally qualified healthcare centers, with the mission to serve Hawaii's Medicaid population. So some of the community health centers are strategically placed in communities where they needed it most, in rural communities, like Waimanalo Health Center is one of our health centers that participates with us. Our provider network, Waikiki Health Center, Kalihi Palama Health Center, Waikiki Health Center, Waianaiko's Comprehensive are all part of our community health centers that founded us. We have over 260 local Hawaii employees, and some of them are member-facing, work directly with, you know, a lot of our members live in the community, and so we're very proud of that. You know, we've been honored to also partner with some of our local providers in Hawaii. Aloha Care is an HMO plan. Kalei kind of shared with you on his educational deck on you know, what that means, but we are a health maintenance organization. And so that's what our provider network consists of, as far as PCP specialists and ancillary providers. Consists of about just under 8,000 total contracted providers, you know, in specific specialties as well as primary care physician sector. We have over 740 home and community-based service providers. You know, as I mentioned, our 880 PCPs, we have specialty providers also in our directory that are participating with us on both plans, both Medicare and on the Medicaid Quest integration side. We have over 930 behavioral health providers with 24 acute care hospitals and 1 behavioral health hospital. Our pharmacy benefit manager that oversees our pharmacy directory. So currently for 2021, as our Medicare plan, we use pharmacy benefit manager Express Script, which manages about 200 plus contracted pharmacies across Hawaii. And then they also have a specialty pharmacy called Accredo, and they focus primarily on helping those with needs such as infusion. They have a dedicated outreach team for medication management therapy, and they've just opened up their office in Kaka'ako. I think it's in the Gold Bond building now, that's open to the public now. So that was an exciting thing when they launched their specialty pharmacy last year. I believe it was like 3rd or 4th quarter last year. So with our dental network, we use Hawaii Dental Service, This is a new partnership. Super excited about that as we go into 2021, 2022 plan year. But we have over 900 contracted dental providers across the state. And so that, our members can go ahead and see any one of those HDS providers that are participating with our network. I'm going to talk a little later on about an over-the-counter benefit that we also offer through our Medicare Advantage plan, or the dual special needs plan. But the vendor that we use is called Income Nations Over-the-Counter, OTC. And then we also partner with CVS Long, Walgreens, and Walmart, where members can go ahead and use the POS system or buy at retail and take the over-the-counter, take their over-the-counter items home with them on the same day. So I will share that information with you a little later on. So primarily in Hawaii, there are about 281,000 eligibles, if you will, that qualify or may qualify for a dual special needs plan, and also for Medicare, as Kalei mentioned earlier. There are about 10% dual special needs plan members that are actually enrolled in one of the 5 dual special needs plan in Hawaii. Aloha Care is one of those dual special needs plans. And then of that 26,000 or so members, Aloha Care has about 2,600 members now that are enrolled in a dual special needs plan across Hawaii. We are a managed care organization that offers this dual special needs plan, which is defined by CMS, the Centers for Medicare and Medicaid, as a coordinated care plan that exclusively enrolls and specializes in enrolling individuals who are duly enrolled in both Medicare and Medicaid. We are a true Medicare Advantage plan. The name of our Medicare Advantage plan is called Aloha Care Advantage Plus, HMO for Health Maintenance Organization, Special Needs Plan, and that's what the SMP stands for. And we do provide coverage for Medicare Parts A and B, so qualified enrollees, as well as coverage for Medicare Part D or prescription drugs. So this gives those that qualify an opportunity to partner with us if they would like to have their Aloha Care their dual special needs plan and their Medicaid Quest integration plan aligned or under one umbrella. So as you can see there on the upper right-hand corner there's an umbrella that has Medicare and Medicaid. So a lot of trusted advisors and certified brokers that are contracted with Medicare plans or dual special needs plan like Aloha Care, do focus on doing the right thing with educating members on the different options that are available, and try to align that member with the right coverage for Medicare and Medicaid, and that would involve educating them on having both their Medicare and Medicaid coverage under one company, such as Aloha Care. So that's a little bit about what a dual special needs plan, what it all means as far as a Medicare Advantage plan. Our Aloha Care Advantage Plus special needs plan has a Medicare contract with the federal government, as well as our Hawaii Department of Health and Human Services Medicaid program. Enrollment in our Aloha Care Advantage Plus depends on contract renewal. So all that means is that we renew with CMS and the state every year, and get their final stamp of approval to allow give us the green light to offer our plan in our state. This plan is available to anyone who has medical assistance from the state, which is the Department of Health and Human Services MedQuest Division, Quest Integration, and also Medicare Parts A and B. So in order to be enrolled in a dual special needs plan like Aloha Care Advantage Plus, the member must meet the Medicaid eligibility criteria for a dual eligible special needs plan, which includes being entitled to Medicare Part A, enrolled in Medicare Part B, and also enrolled in the Quest Integration Medicaid program. And most importantly, they must live in the service area, which is the state of Hawaii. So if someone would qualify, for both Medicare and Medicaid, they may be eligible to receive assistance from the state. And also another program that may help with their prescription drugs called low-income subsidy that may help with co-pays, co-insurances at the pharmacy, and also with our Medicare D-SNP health plan. Some of the advantages of being enrolled in a dual special needs plan: take advantage of the combination of the benefits for Medicare and Medicaid funding and the benefits that are allowable for what we call full benefit dual eligible members. So there's 5 different insurers offering dual special needs plan in the state of Hawaii. Aloha Care, as I mentioned, is one of them. And we're required to offer a unique model of care that meets the special needs of the individual that is enrolled in our dual special needs plan. So on the right-hand side, you'll see that sometimes circumstances change and a member may no longer qualify for meeting the eligibility criteria for Medicaid. So what that means is that they will no longer qualify for our plan then, and their dual special needs plan enrollment will end 6 months after their loss of eligibility unless they regain eligibility during that 6-month period. So if that happens, Aloha Care, for the plan that they're enrolled in at the time, will send them a notice or notification informing them of the loss of coverage and end the date of the membership of their membership in the D-SNP plan. You will also receive a notice. The member will receive a notice outlining their ability to switch into other plans and provide some other resources and options that the member can call if they have any change in their eligibility and again, no longer qualify for Medicaid. So I did want to mention that, we do partner with a designated team. Some of them are on Kalei's agency team of agents, qualified, certified agents that are contracted with us to assist members with that process and helping them to regain their Medicaid status. Because we all know the application process with with Quest, that Form 1100 is no picnic. It's very long, sometimes confusing. But if you partner with a trusted advisor, like somebody who specializes in Medicare and Medicaid, like an agent on Kalei's team, then they may be able to not only help them with the application process, but educate the member on what would be available to them should they not qualify anymore for Medicaid. So now I'm going to go over some of the benefits for the 2021 plan year for our Medicare Advantage plan called Aloha Care Advantage Plus HMO Special Needs Plan. So again, we are a Medicare Advantage plan defined by CMS as a dual special needs plan. And so, we always like to emphasize plan alignment. And if somebody has Aloha Care Medicaid and is enrolled in a Medicaid Quick Integration program with us, they can also choose to get their Medicare benefits if they have Medicare Parts A and B with the same company, Aloha Care, and have their CAID and care benefits under one umbrella. So they can enjoy the convenience of having to call one plan, one customer service. The doctors love it because, the claims will get adjudicated faster. But these are some of the benefit highlights for, again, our 2020 plan year for our Aloha Care Advantage D-SNP plan. So there's no cost to participate with our plan because the member would be considered a full benefit dual eligible. The member doesn't pay any health plan premium to have this plan. We do offer a $2,500 comprehensive dental coverage benefit, which will allow them to go ahead and see one of those Hawaii Dental Service or HDS providers that are participating with our Medicare Advantage Plan network. We have a $150 benefit per quarter for our over-the-counter benefit, where a member can go ahead and go to Long's, Walgreens, or Walmart, go to the pharmacy section, look for one of those OTC approved items, and take advantage of using that $150 per quarter. If they don't want to go out, not a problem. We have a catalog. They can order from the catalog, call an 800 number, and then have the over-the-counter items shipped directly to their home. We have a therapeutic massage benefit where the member will be entitled to 12 visits per year for therapeutic massage. That's an exciting benefit and great for therapy as well as our acupuncture and other acupuncture related alternative therapies, where we have 15 visits a year to $1,000 maximum benefit for acupuncture. We have a transportation services for health-related transportation rides. So non-emergent ground transportation, where the member would receive 24 one-way trips to and from the dentist, to and from the pharmacy to go pick up their medication. Those are some examples of what they can use their transportation benefit for. We also have worldwide emergent and urgently needed care services. So if somebody is traveling, pre-COVID, right? The member has access to worldwide coverage for emergency and urgently needed care. And then of course we have a care manager. The member would have access to a care manager, lead care manager, or service coordinator to help them coordinate their care through primary care physicians and also through specialty care if needed. Members of Aloha Care Advantage Plus, members of our DSNP plan, because we're an HMO, health maintenance organization, they must use in-network providers to get their medical care, hospital care, and utilize their benefits. So we don't have an out-of-network benefit. If there is not a provider that's listed as participating with us and the member would like us to reach out to that provider, however, we do have our provider relations department that can potentially contact that provider to see if they would be interested in partnering with our plan and participating with our network. So I believe that you heard this from both Herman and also Kalei, but I'll just go ahead and say it anyway. The Aloha Care Advantage Plus also offers some supplemental benefits in addition to Part C and Part D prescription drug benefits. So we do have what we call core documents or member documents that are on our website. And so one of those documents is called a summary of benefits. So this is just basically exactly what it is, a summary of our Aloha Care Advantage Plus benefits that the member does have access to. It's not everything listed as far as benefits are concerned, but it is just a brief summary of what we do offer for our members. These plan materials are available on our aloha-care.org website under our Medicare tab header. If you are interested in seeing what that summary of benefits and other core documents look like. The member or those interested can also call our member services phone or toll free at that 1866 number there you see listed on the screen. And then for those that have hearing impairment or for the disabled, we do have that line available as well. So the value-added benefits for our Medicare Advantage Dual Special Needs Plan would include all of the ones that you see checked up on the right-hand side under the Aloha Care Advantage Plus column, as opposed to Original Medicare. So this just basically outlines, that Original Medicare does not cover all of these extra or value-added services that Aloha Care Advantage Plus does cover. So, the member does get, the extra benefits that they can take advantage of, rather than just have regular Medicare Part A and Part B. If somebody is deemed as full benefit dual eligible with the state, then and they have our Aloha Care Advantage Plus plan, medical and hospital benefits, copays, and coinsurance will no longer be valid. So the member would pay no copays, no coinsurances for all those services that you see listed on the screen. So this would include primary care physician visits, specialty visits, behavioral health, mental health visits, etc. So again, everything that you see listed here for medical and hospital services, the member, if enrolled in our Aloha Care Advantage Plus Medicare plan, the member would pay no out-of-pocket copays for these services. Different ways to enroll in our plan. So for those that want more information or would like to go ahead and enroll in our plan, they can do so by logging on to our website at alohacare.org under the Medicare Enrollment tab, or they can call or log on to the CMS website at medicare.gov. Our office number for our Medicare sales office, you'll see listed there, it's at 973-2479. That's, we can connect you to a certified agent or broker, like Kalei's team or Kalei himself, to go ahead and schedule and reach out to a member to educate the member on our benefits and see if they're interested in enrolling. These are our hours of operation here. So as you can see, we're gearing up for open enrollment, which runs from October 15th to December 7th, but we can actually start marketing our Medicare Advantage plans from October 1st. So from October 1st to March 31st, Aloha Care's office will be open 8 a.m. to 8 p.m. 7 days a week. So that will start October 1st, but April 1st to September 30th, we're open 8 a.m. to 8 p.m. Monday through Friday. So now I'm going to go into a little bit a high-level overview about our Quest integration program with the state of Hawaii, and then different ways that one can enroll in Medicaid. So for those that would like to apply for Medicaid, as I mentioned earlier, we do partner with a designated team that specializes in enrollment and education efforts and initiatives with Medicaid. So they can actually help them walk through the application process. They can educate the member on the different tools and resources that are available through DHS. And then also, if they want to go on their own, they can go ahead and log on to mybenefits.hawaii.gov, create an account online, and then apply right online. So for somebody that's a little older and our kupuna, they really have a hard time, or maybe no more computer, yeah. So this is where your seasoned licensed agent or broker can help with this process, because it does get very confusing. I helped my grandmother go through this. My grandmother, just short story, wanted to share HMSA coverage for many years that my grandma had. And then when she got sick, cancer, utilized all her savings, we had to help with the spend down period for Medicaid. And I went through that whole process and learned about the whole process, when I was in my early 20s. So it was very, very confusing. If I wasn't there, with my family trying to navigate through the whole process, we would have never got the help with the state that I'm truly grateful for. So, for those of you who have maybe some, do outreach to the community or kupuna that need assistance, we can also help them navigate through the process. So I just wanted to be clear that the Department of Health and Human Services, my Quest division, they determine who is eligible for Medicaid, and they look at your asset level and your income. Okay, so that's the way that they determine, what level that you would qualify for. So there's different requirements for children, adults, and seniors. There's, different criteria for income. It's all based off the federal poverty level guidelines. And that's what the state uses to determine the eligibility. And then they'll notify the members through mail on what level they would qualify for. So as far as Medicaid benefits, medical and hospital benefits are covered. For the 2021 plan year, these are the benefits that are fully covered and more. So doctor visits, hospital services, rehab services, prescription drugs, and this is on the Medicaid Quest integration side now. So long-term services, support, health coordination would also be included. And so, these are fully covered for those that do qualify for the Medicaid Quest integration program. I also wanted to mention that Aloha Care does have value-added services within our Medicaid Quest integration program. And so I'm pretty excited to share our value-added benefits that just launched July 2021. So all of these things that are just traditionally not covered by health plans, would contribute to, assisting those to stay healthier. And then, we looked at different social determinants of health, right? So all of these value-added services that you see that I'm going to be reviewing, they kind of complement the whole person care. So within Aloha Care's value-based services for our Medicaid Quest integration plan, we do offer, we're the only Medicaid plan that does offer adult basic dental. Okay, so that's pretty exciting for those that are 18 and over, and then that qualify. We do have a high school equivalency program that we're launching, or that we did launch. Okay. And then we're slowly going to be rolling out some other services that will contribute to Native Hawaiian healing. And then we are partnering, with different providers across the state, to offer some of these programs through our Native Hawaiian healing, our Ke Aloha Mau program, such as hula, lomi lomi, aipono, and ho'oponopono. So hula will be launched, our hula benefit will be launched next month in October. So that's super exciting. And then all of the other programs like Lomi Lomi, Aipono, and Ho'oponopono will be launched next year, starting January 2022, and going into the different months. So again, we are so proud to partner with some of the partners that we have as far as provide these benefits to the Native Hawaiian health systems across the state. That will have, that will be accepting our members, with our Medicaid plan. But we will have limited number of sites available when we launch, and then limited number of members that will be allowed per site. So we'll share more information. I'll connect, as more information becomes available. We'll probably partner again to hui together and do another collaboration like this to provide, some great updates of, as they happen for next year. So I did want to highlight that high school equivalency. It's another way to address the social determinants of health for those that are 18 through 50 years old, and social economics that we took a look at, and then also, to help with, the literacy, because it's a feel good, right? Then you get your high school, your GED, or you're doing, taking some classes to help better yourself. I mean, all of those things contribute to, our social and economic status in our communities, right? And so we're super happy to launch these programs, through Aloha Care's Medicaid Quest integration program. I wanted to thank Lisa. Thank you so much for setting this up. For those that were able to attend, thank you for making the time and listening to all of us speak today on Medicare Advantage. I've worked with Kalei since 2006 in the Medicare Advantage world, and Herman too, a very long time in the industry. So I do appreciate the opportunity to present and look forward to maybe future opportunities to go ahead and share updates with Aloha Care.
Mahalo for those that are still with us.
They're probably taking a nap.
It's lunchtime, and even an hour's long, but you stuck with us. And for those that are still here, we will totally email all the handouts, the questions in the Q&A feature and in the chat feature, and then we'll also provide contact information for anything that may have caught your attention and you really want to find out more about straight from them. We'll provide that as well. So have a great weekend. Malama pono, malama kekahi. Just want to say that the next webinar is going to be on October 8th. And that's going to be the part 2 of our community health workers. So we're going to feature those that weren't featured in the last webinar, talking about, the things that they do on neighbor islands. So, ahui ho, malama pono, we'll keep in touch.